Good afternoon, everyone. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, the Honourable Ian Rankin, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Chrissy. Good morning, everyone, and thank you for joining us. Today is the speech from the throne and the opening of the House of Assembly, so we're providing our update a little earlier today. It is so important for us to give you the most up-to-date information so you can make informed decisions and help keep our case counts low. And so Dr. Strang and I will continue to give you updates on Tuesdays and Fridays for the duration of the House sitting. Now let's get to the numbers. Today we are reporting 5 new cases, 3 in the Central Zone and the other 2 in the Western Zone. All of the cases are close contacts of previously reported cases. Nova Scotia Health Authority's labs completed 2,841 tests yesterday. In total, we have 26 active cases of COVID-19 in Nova Scotia, with 1 in the hospital in the ICU. Dr. Strang will have more to say on vaccines, but I'd like to note a few things. I was very pleased to hear that late on Friday we learned we would receive more of the Pfizer vaccine at the end of March. This is more than we originally expected, actually 3 times as much. This means more first doses of vaccines for more Nova Scotians. We're also going to be rolling out the AstraZeneca vaccine on Saturday, March 20th. Dr. Strang will share specific details about that in just a few minutes. Yesterday, we opened more appointments for Nova Scotians over the age of 80 to get their first dose of the vaccine in the month of March. About 6,000 appointments were booked yesterday, the vast majority of them online. This time, the booking process was much more efficient. Asking people to book based on their month of birth really helped to decrease the volume and frustration for those trying to book appointments. We appreciate the patience of Nova Scotians as we ramp up our distribution of vaccines. We will be opening more appointments as soon as this batch of available appointments is about 3/4 through. Our goal with the appointments is to make sure all available slots get booked and no vaccine gets wasted. And finally, the first prototype clinic opens today in Spryfield at the Guardian Pharmacy. We are really looking forward to hearing how that goes. Dr. Strang has said before that our vaccine plan is flexible. It's a good thing because look how much things can change in just a week, from 2 new vaccines being approved to the increased supply of the existing vaccines already in use. This will require us to move quickly, and I want to ensure all Nova Scotians that we're ready. We're training hundreds of people to deliver COVID-19 vaccines, and we're bringing pharmacies and doctors' offices on board to help move as quickly and more efficiently as possible. Thank you to everyone for stepping up and doing what needs to be done to ensure Nova Scotians can get this vaccine. Lastly, I want to say that I will be having a discussion with my fellow maritime premiers next week to discuss next steps regarding our borders as we consider reestablishing the maritime bubble in the weeks ahead. As always, we will be guided by public health, as safety is always our primary concern. Thank you, and I'll now turn it over to Dr. Strang.
Thank you, Premier. I guess it's good morning, everybody. As the Premier talked about our case numbers, and of course I'm very pleased that they are staying low. And really that's thanks to all of you, all Nova Scotians, and to the border restrictions, public health measures, and testing requirements that we have in place. I do want to talk a bit about the new variant cases that we are announcing today. So the National Microbiology Lab yesterday confirmed we have 5 new variant cases, 3 of them of the UK variant, and 2 of them South African. All of these are in the Central Zone within Nova Scotia. So that, that brings the total number of cases of the UK variant in Nova Scotia to 11, and the South African variant to 8. All 3 UK variant cases and 1 of the South African variant cases are directly linked to previously known variant cases or to international travel. The other South African variant case has no known link to a previously reported COVID case or to travel. This person was tested earlier this month, and their illness is now considered resolved. The investigation around this case is still ongoing, and so far, despite an extensive number of close contacts that have been tested, all of them are negative at this point. So right now, there's nothing that leads us in public health to believe that there is community spread from whether it's the regular COVID strain or any of these variant cases. So that's really good news. But the fact that we have these variant cases at all is a reminder how our situation could change very quickly. Now I'd like to give an update on some of the elements of our vaccine program. This week, as we're preparing to launch the rollout of the AstraZeneca vaccine, we are also starting community clinics for those 80+, continuing with healthcare worker clinics, our long-term care clinics, and the pharmacy prototype clinics, and our First Nation clinics. So as the Premier has noted, a lot has happened in the past week, and we expect this to be the norm for the weeks to come with our vaccine program. We're about to have much more vaccine in the province than we expected, from the 13,000 doses of AstraZeneca that are coming next week to the more than 38,000 extra doses of Pfizer vaccine that we'll get in the last 2 weeks of March. But we are ready to scale up our vaccine program and to get this vaccine into arms quickly. There's no doubt that this will require work, but we are able to respond because of the detailed planning that the vaccine team has been doing from the middle of December. We are continuing to train people to give these vaccines, but that's only one aspect. We're also introducing new ways to deliver the vaccine with our first pharmacy prototype clinic for launching today, as the Premier said, in Spryfield for people who are 80+. An immunization program of this size requires everyone involved to be nimble and flexible. And I want to thank our many partners who are moving mountains to make this happen, to make sure that there's access in communities across the province for all Nova Scotians. But it will require patience. This doesn't happen overnight. It'll take us several months to do this, as we cannot get out ahead of our and go faster than the amount of vaccine supply that we have available to us. Let me give you now a bit more detail on the AstraZeneca plan, which we announced last week. While this is a different vaccine from the Pfizer and Moderna product, we do know that all three vaccine products have good effectiveness against preventing severe COVID illness and hospitalization, and they've all been shown to be safe. So we've decided to take the same approach as we've done for the 80+, knowing that the AstraZeneca's vaccine is only for those people who are 65 and under. That's what it's licensed for in Canada and recommended for. So when we looked at it last week, we talked about we'd make it available for people 50 to 64, but there's over 200,000 people in that age group, and we only have 13,000 doses of vaccine. So that we learned from last week with our 80+, so to make it less frustrating to booking, we are going to start for people who are age 63 and 64 when it comes to those who have the first opportunity to book an appointment for AstraZeneca vaccine. So next week, people who are based on their birth date who are 63 or 64 will be able to contact the central online or phone to make an appointment, and we have 25 locations across the province where the doctor's offices and pharmacies. That location list will be available on our website soon. It's also been included for the media in the media release. And for people who, once they start to make appointments, as you go online, that information will be available as you make your appointment as well. But there will be 25 clinics spaced across the province, and when people book an appointment, they'll get both an appointment for their first and their second dose, and the standard interval for the AstraZeneca has always been the 16 weeks. So the first of those clinics will start March the 20th. We are anticipating more AstraZeneca vaccine later in March and again in April. And as our supply of vaccine increases beyond this initial allotment for 13,000 doses, we will continue to offer this vaccine to Nova Scotians between the ages of 50 and 64, working backwards from 64 by age. In conclusion, I'd just like to say that for all Nova Scotians, that your turn to get vaccine is coming. We are doing our part to make sure that there's timely access across the province for all Nova Scotians. And when your turn comes, I'm asking all Nova Scotians to step up and get their vaccine. When you're eligible, book your appointment, get your vaccine, and encourage your friends, family, and loved ones to get theirs. Getting the vaccine is our way forward. The faster we build population immunity, the greater the level of protection we have against COVID. It's how we continue to protect ourselves and protect each other, what we've done through the whole pandemic. Chrissy.
We'll now take questions from media both in the room and on the phone. We'll do one question and one follow-up in the time that we have for today, starting with All Nova Scotia's Lindsay Armstrong.
Thank you. I'm wondering if we can get some clarification on the reopening of a maritime or Atlantic bubble. When are we looking for this to happen? And just to clarify, is it going back to the Atlantic bubble that we were used to in the summer months?
I can start with that. I had preliminary discussions just with the maritime provinces, so that would be only New Brunswick and PEI. I haven't contemplated Newfoundland at all at this point, and we just, like I said, had a discussion about the potential of doing that in the near future. But we're going to have a more constructive conversation on how that would look. And again, depending on the epidemiology, our chief medical health officers are going to make sure that they're meeting as they do regularly, and we would need the comfort looking at our own epidemiology and the neighboring provinces. But we understand that there's benefits with our 3 provinces and the movement of people and goods throughout our region. So we're going to have that discussion next week.
Go ahead with your follow-up, Lindsay.
Thank you for that. I think this is for Dr. Strang. Looking at herd immunity, we've talked about 70% or so, I believe. I'm wondering if that's based on people receiving their first doses, or is that 70% of people who've received both first and second doses for that?
So it's both. I mean, we're looking at what's the level of, when you say herd immunity, I use the term population immunity. What's the level of people that are that have immunity against the virus? That gives you, that you can start to then contemplate there's enough protection through immunity that your risk of having large outbreaks and it starts to substantially decrease. So you can get immunity whether through illness, and fortunately we're in a place in Nova Scotia that we've had very few people, so we have to rely on vaccine to give us immunity, which is actually a good thing. Other parts of in the U.S. they have already a leg up on us, if you will, but it's not in such a good way, because they've had like 30% of their estimates of 30% of their population is immune from disease. Not necessarily a good thing. So, but we know now with the vaccines that a single dose gives good immunity to sustain that immunity, and this is important for Nova Scotians, to sustain that immunity long term. They have to get that second dose. So what we need people to do is get the first dose, which builds our population immunity in the short term, but we then need them to get the second dose so we can sustain those high levels of population immunity longer term.
Next question will go to Global's Jesse Thomas.
Thank you. I guess when it relates to this discussion with the premiers regarding the maritime bubble, I'm wondering what can be looked at in particular and discussed, given I understand you guys will yield to public health to determine when that can open.
Yeah, so it's a number of factors. Obviously, number one needs to be ensuring that we have full comfort from all 3 public health departments. New Brunswick has recently lowered their threshold down to what they classify as yellow. We still have right now the lowest cases counts in the country, so all 3 provinces are doing well. But I think given that we've always used the cautious approach, it's worked for us over the last several months, so we're going to continue to take that approach, and we just had one conversation about it, so it's early days, but we'll have that next week. We'll talk about that further.
Go ahead with your follow-up, Jesse.
It's early days in those conversations. Dr. Strang, what's your relationship like, or your discussions like with your counterparts in those 2 maritime provinces? What are you looking to see? Is there a timeline when maybe we can understand that this bubble would come back? Well,
first of all, I mean, I've had throughout the pandemic, I have weekly calls with my Atlantic Chief MOH colleagues. We had a conversation on this on Monday. We clearly know that, as the Premier said, Newfoundland is in a different position, so they have a longer road to recovery. Our job is going to talk at our level on public health and give a common advice to our premiers, knowing that public health, and we have to look, that goes into the main piece, but there's also other factors around the importance of people and goods being able to move freely. So, but we'll continue to have a conversation and making sure we're on the same page, giving advice to our premiers from a public health perspective.
Next question will go to CBC's Shayna Luck.
Dr. Strang, I know we have the community clinics open or opening soon, but for people who aren't near one of those, is there a point at which you would consider opening more, or are we going to be sufficiently covered by pharmacy clinics? How does that look?
So if you see our, we need to we will be talking in more detail. That we have an increasing number of community clinics that are going to open up. There more and more local access will happen, but we're also working with community transportation network in the province that people once we get robust supply, that people where that transportation is an issue, whether they live alone, they're an isolated part of the province. So we'll be able to have mechanisms to get people to clinics, and ultimately, if there are people that are isolated for medical reasons, we're working with our home care agencies that there are going to be some people that ultimately we would maybe bring vaccine to them. Those are further down the road because our goal is to get as much vaccine into as many arms as quickly as possible. So our first objective is to use opportunities that allow us to immunize lots of people in a short period of time. Then we build population immunity, which protects all the others. Then these people that need more individualized approaches to make sure they're getting vaccinated, we will certainly work them into the system. But we are well aware that access to vaccine is not the same for everybody, and we have to have multiple approaches to ultimately make sure everybody gets an opportunity to get a vaccine.
Go ahead with your follow-up, Shayna.
So at what point do you think in the timeline we would be moving from that stage where we're getting people to come to the vaccine and then we're starting to move people to, move the vaccine to people? At what point does that happen?
Well, it's the vast majority of people, it's always going to be getting them to come to a clinic. But I'm just pointing out that we know that there are some people that they need support, and that what are the community supports that can get them to the clinic. And there's ultimately going to be some people, very small numbers, that because of their medical condition, that we need to work with home care agencies to get them immunized in their homes.
Next question will go to the Halifax Examiner's Tim Biscay.
Dr. Strang, you've been very clear all along that vaccination will go by age cohort. Well, we became aware recently that there's over 40, we're told, upwards of 40 Halifax police officers in self-isolation. And yesterday at the police commission meeting, they called for police to be vaccinated higher on the list. I'm wondering what your response is to that. Can you confirm that number, and would police be able to jump the list?
So we have a conversation with police at 12:30. I'm well aware of the cases that are in the Halifax offices. It's unfortunate as being portrayed that the people are seeing that those cases are a result of frontline work. There was an individual case that was then spread throughout the office. Not because of people exposed on the street, frontline police officers, it was happened in the office setting, which has then created a number of contacts. So we're having a conversation with the police about their office-based COVID protocols, which have allowed spread of the virus within their office space, which is very different from their frontline officers being at risk. If you look across the country, we are not seeing frontline police officers being a group that jumps out as having excessive amounts of COVID cases.
Go ahead with your follow-up, Tim.
I'm hoping you can help me run the calculus here with the AstraZeneca. And I'll just use myself as an example because I fall in the age group that is eligible for that. Should I go to one of these pharmacies and attempt to get vaccinated, even though I'm at relatively low risk, I don't have a lot of social contacts? Or should I wait for the Pfizer, thinking that bartenders and people at higher risk should go get the AstraZeneca first?
So, I mean, ultimately, it's an individual choice. But I would say, like public health officials across the country, if you get an opportunity to get a vaccine, take it. All of the vaccines we have, the 3 we have now, and the evidence on the ones that are in the pipeline, they're all effective at preventing the worst outcomes, which is severe disease, hospitalization, and death. Some of them may have a left with more of a slight increased risk of getting mild disease, but that's not really what we're protecting. Vaccination first and foremost is about building enough immunity and preventing severe disease. So if you get a chance to get a vaccine, I would recommend people take that opportunity.
We'll now go to the phones to Danielle Edwards with the Canadian Press.
Hi, I had a question about the vaccination plan for Nova Scotia. I was reading that Ontario is planning on allowing people who are immunocompromised to access vaccinations. Is Nova Scotia planning on perhaps opening up the vaccinations to those who have asthma and other pre-existing conditions?
We are not at this point in time. We're certainly looking at, are there some very specified medical conditions that later on down the road we might be able to have, through a special kind of a clinic approach. But our objective is to follow an age-based approach for the first part of the major part of our vaccine program, because it's an age-based approach which allows us to get as many vaccines into people's arms as quickly as possible. And so that is our objective, building population immunity as quickly as possible. And the more we divert away from an age-based approach to accommodate, I recognize people's concerns and the challenges they have, but the more we try to build all of those, it actually slows down our overall progress to building population immunity. And if we have rapidly building population immunity, what that is doing is protecting those individuals themselves while they're waiting to get vaccinated.
Go ahead with your follow-up, Danielle.
And is there any idea of how many people exist in that 63, 64 age range? Will all of them be able to get vaccinated with the AstraZeneca, or will there be others who need to wait for the following shipment?
No, I had the numbers in front of me yesterday, and I think it's maybe around double the 13,000. We're not sure what the uptake's going to be, so we will see what once it becomes available. We'll see how many people get an appointment for AstraZeneca in that 63 to 64, and if there's vaccine that's remaining, then we will open it up to then decreasing ages. And as I said, we also know that we're getting more AstraZeneca later in the month and in April. That hopefully we will then be able to continue this AstraZeneca stream, if you will, and go down into decreasing ages.
Next question will go to Naval Snow with the Herald.
Good afternoon. Dr. Strang, we've heard from some people that they had difficulties booking an appointment yesterday for the vaccine despite the changes to the booking system, and they were wondering why letters weren't sent with specific times and dates that they can approve or reject. So what would you say to these people about our rationale behind the booking system that we have now?
So, I think no booking system is going to be 100% perfect. What we heard yesterday, that overall, that there was a strong satisfaction that many people were able to book within 5 minutes. To send letters out to people and then get them, that's a much more complicated process. So we've gone with the online or phone process. We will be sticking with that, and it worked much better than it did last week. So it was a big improvement. There's always going to be a few people that it doesn't work as well for, but the vast majority, all the reports we had that I've received yesterday, the vast majority of people, it went very smoothly.
Go ahead with your follow-up, Nabal.
Thank you. I also have another question for you, Dr. Strang. So if people who are in the age range to get the AstraZeneca vaccine wait to get another vaccine, will it be the Pfizer vaccine or could it be something else?
It could be Pfizer, it could be Moderna. There's two, once we get through our long-term care facilities, depending how much Moderna we get beyond there are other vaccine products that we're waiting to be approved. The first one is Johnson & Johnson. So as we get further down the road with our vaccine program, there's going to be multiple vaccine products that we have. Right now, we're giving people the option because a small amount of AstraZeneca, but as we get into the longer down the road, that people may not have a choice. It's whatever vaccine we have available at the clinics. Because again, all the vaccines are basically equivalent in their ability to protect people from severe disease.
Next question will go to Sarah Plowman with CTV.
Hi, I'm wondering what will be in place for the day that people are able to book the AstraZeneca vaccine, just to make sure that once again we don't see the online system overwhelmed like it was last week. What's your strategy to make sure that it doesn't happen and continue to happen when it's become available?
So that's exactly why we were opening up just to 64 or 63-year-olds. That's a number of people that would not overwhelm the system. Simply like we made the choice when we reopened yesterday for seniors, it was people from January to the end of April. So if you have a focused way of having a group of people that the numbers are not big enough to overwhelm the system, and then when they get a chance and they book, then you move to the next group in the system.
Go ahead with your follow-up, Sarah.
And I'm just wondering why it was determined that booking by month of birth was a fair way to book the age group over 80. There are some examples of people who are, more at risk, who are born in December, who are not able to get an appointment right now, but yet their spouse who is healthier and younger and born in January or February is.
And that was a choice we made. If we'd chosen, by age, then there's going to be some people saying that I'm 80 and I'm, earlier on, younger age, that are much more at risk. So either way, there's going to be people that it doesn't necessarily aren't necessarily completely happy with the system. But breaking it up by that birth months was allowing us to have a controllable number that can actually not going to overwhelm the booking system. And the reality is that once you get into the 80 plus at a population level, everybody's at about the same risk. So we needed to choose one approach, and then we start to get people and move them through as quickly as we can throughout, adding on additional birth months.
Next question will go to Adrian Blanc with Radio Canada.
Ma question est pour le Premier ministre. Monsieur Rankin, vous avez dit que pour que la reconstitution de la bulle se fasse, les 3 provinces doivent être confortables avec cela. Qu'est-ce que vous voulez dire exactement?
Merci pour la question. Je vais commencer en français, mais en anglais aussi. Les 3 provinces avoir beaucoup de succès jusqu'à le point maintenant. Les cas sont en bas de l'autre région de la pays. Our cases in this region, in the Maritime region, have been lower than the rest of Canada. Credit goes to Maritimers for listening to protocol and the regulations, restrictions that we put in place. The conversation has just started, so we'll be continuing to talk as premiers and our medical health officers to determine when the right time is to open up back to where we were, to allow people to go over borders. Right now, as you probably know, there's no restrictions on people coming from PEI. Now we're looking at New Brunswick and their cases coming down. So I look forward to those discussions, but we won't be making any changes until we have full comfort from our public health.
Go ahead with your follow-up, Adrian.
Et est-ce que l'industrie touristique peut commencer à se préparer à la reconstitution de la bulle atlantique?
So that's with Newfoundland, we haven't had those discussions. Newfoundland, as Dr. Strang mentioned, is in a very different position right now, but we would entertain that option in the future.
Next question will go to Victoria Walton with The Coast.
Thanks. Dr. Strang, I'm wondering, going back to talking about HRP, could you confirm for us where that original case came from if it wasn't working on the front lines with the public? Was it travel related?
No, that's one of the cases that we've had. We don't have a clear explanation for their exposure, but the subsequent cases have occurred through exposure in the workplace.
Go ahead with your follow-up, Victoria.
Thanks. And Strang, this one's also for you, and I don't want to put you on the spot, but you are somewhere, I think, in that age range for the AstraZeneca vaccine, at least in the coming weeks. I'm wondering if you'll be looking to get the AstraZeneca, is that something that you want to get? Will you wait for Pfizer? And kind of on the topic of that, I know you said there will be public advice for people in that age range to make that decision. Is that advice out yet now that we're starting the rollout? Where can people go to for more information?
So thanks for calling me out. Yeah, I'm not quite at 63, 64 yet, so I'm hoping the 13,000 has used that before you have to go down to me. But yeah, I'll have the same choice when it comes to me. We're going to have, as I said, we're developing that information. I just was looking at yesterday a consent form that'll be available to people, as well as what the same information what we have online. But the bottom line for Nova Scotians to hear is that if they're eligible for AstraZeneca, I would recommend they take it. We know that all of these vaccines are about about equally effective against preventing especially severe disease. Some of them may have a slightly higher risk than others about a very mild disease, but it's the severe disease, the hospitalization, the death that we're trying to get everybody immunized as quickly as possible against.
Next question will go to Carolyn Ray with CBC.
Hi there. I just wondered if you could clarify something. I'm seeing on social media people are saying that a number of spots are still available to book this week for the first 80-plus cluster this week. I just wondered, have all of this week's spots been booked?
The update I got that we had a relatively small number of a few thousand left, which was the first thing this morning. I'm hoping that they're going to be filled up very, very quickly. But we'll see what we get with January to April, and if they're and once those people have had a reasonable time in those birth months to get booked, we'll then move for an additional a number of spaces for the subsequent block of 4 months.
Go ahead with your follow-up, Carolyn.
And I'm just wondering, has your office seen an increase in the number of special interest requests since you've announced more and more vaccine is on the way?
We've had a number of, over the last months, whether it's based on occupation or based on health condition, a number of groups, many groups reaching out to make the case for themselves. But I continue to come back to, with a few exceptions, that our best approach for Nova Scotia, and this is about thinking about the whole population, which is my job, to think about what's best for everybody. Lots of people are thinking about what might be best for them. But what's best for everybody has basically an age-based approach, which allows us to build population immunity as quickly as possible.
And that's all the time we have for questions today. Go ahead, Premier.
Thank you, Christy. It may feel like a bit of a roller coaster right now. No cases yesterday, and then 5 new cases today. But this is the nature of the beast. What I see, however, are more and more Nova Scotians getting vaccinated. Our program is proceeding on a good schedule. What I see, too, are low case numbers because of the actions and behaviors of Nova Scotians. So thank you very much for those efforts. We are continuing to get tested. We are following public health guidance, washing our hands, wearing masks, and keeping our distance. Thank you, and keep it up.